Herpes simplex viral infection. Definition of a virus. A virus is an infectious microbe consisting of a segment of nucleic acid, either DNA or RNA, surrounded by a protein coat. Characteristics of virus. A cellular structure made up of DNA or RNA, obligate intracellular parasite, no metabolism, can be crystallized and mutated, specificity, measurable in nanometers. Herpes virus. There are 80 known herpes virus. Out of them, 8 are known to cause infection in humans. Herpes simplex virus 1 more frequently causes orofacial infection, infects above the waist. Herpes simplex virus 2 causes genital infections. Herpes simplex virus 1, herpes simplex virus 2 and varicella zoster are viruses that are known to cause oral mucosal disease. Cytomegalovirus is an occasional cause of oral ulceration in immunocompromised patients. Herpes simplex virus 1 is spread by direct contact, usually by infected saliva. Herpes simplex virus 1 causes acute gingivostomatitis and recurrent herpes labialis. Herpetic gingivostomatitis usually occurs in children and reaches a peak between 2 to 3 years of age who have not been previously exposed to virus. Clinical features. They develop a prodrome of fever, anorexia, irritability within 2 to 3 days of prodromal symptoms. Erythema and clusters of vesicles develop on hard palate, attached gingiva and dorsum of the tongue. Vesicles break down to form ulcers. Gingiva is often fiery red, edematous. Several small gingival ulcers are often present. Treatment. Primary herpes simplex viral infection in healthy children is self-limited. Mild cases can be managed with supportive care. Acetaminophen for fever and fluid to maintain proper hydration and electrolyte balance. Topical anesthetic if patient has difficulty in eating. For moderate to severe cases, acyclovir can be administered. Herpes labialis, also called as cold sore, fever blisters caused by herpes simplex virus 1, occurs due to reactivation of viruses. Clinical features. Occurs on lips, most often the vermilion border. Often presents initially with prodromal symptoms such as tingling, burning or itching. After 1 to 2 days later, cutaneous eruption appear as a localized cluster of small vesicles or erosions on an erythematous base. Treatment. Topical or oral antiviral agents are used in symptomatic cases. Differential diagnosis of herpes labialis. Angular cheilitis. It is an inflammation at the corner of the mouth, often caused by candida or bacteria. Unlike herpes labialis, angular cheilitis may not involve vesicles and is often caused by nutritional deficiencies. Aphthostomatitis. These are painful, shallow ulcers that can occur on non-keratinized mucosa and on lips. They are not typically preceded by vesicles and are often idiopathic. Erythema multiforme, major. A more severe inflammatory condition commonly involving lips and typically presents with target-shaped lesions and systemic symptoms. Herpes zoster, also known as shingles, caused by varicella zoster virus. Primary infection results in chickenpox. Recurrent infection causes herpes zoster. Herpes zoster is an acute viral infection. Clinical feature. It starts with prodromal symptoms, headache, myalgia, fever, which often followed by rash, itching, burning and tingling sensation, usually limited to one side, along the course of the affected nerve. Unilateral vesicles on an erythematous base then appears in clusters, chiefly along the course of the nerve. Nerve most commonly affected are the trigeminal nerve and its branches. Ophthalmic branch is affected more common, leading to corneal searing and blindness. Facial and intraoral lesions are characteristics of herpes zoster involving the second and the third divisions of trigeminal nerve. Diagnosis is based on history of pain and unilateral nature and segmental distribution of the lesion. Differential diagnosis of herpes zoster are herpes simplex virus infection and pemphigus or pemphigoid. Differentiating features are herpes simplex viral infection appears in a similar fashion and if mild and localized to one side may be mistaken for herpes zoster infection. Culture is used to differentiate the both. Other blistering or ulcerative conditions such as pemphigus or pemphigoid are chronic and do not present unilaterally. Epstein-Barr virus. Infectious mononucleosis. It's caused by contact, typically with salivary secretions. Besides Epstein-Barr virus, other causes of infectious mononucleosis include cytomegalovirus and toxoplasma. Clinical features: fever, sore throat, fatigue, and tender lymph nodes are classical findings in infected individuals. Incubation period is along 3 to 6 weeks. Classical triad is fever, pharyngitis, lymphadenopathy. Additionally, multiple petechiae appears on the soft palate. Treatment is generally supportive. Analgesics and anti-inflammatory help to treat fever and sore throat and encourage hydration and complete rest. Most common complications of herpes zoster is post-herpetic neuralgia, defined as burning pain remaining for over a month after the mucocutaneous lesions have healed. Risk increases significantly after the age of 60 years, most likely due to decline in the cell-mediated immunity. Herpes zoster, infection of the geniculate ganglion, Ramsay-Hunt syndrome is a rare form characterized by Bell's palsy, unilateral vesicles of the external ear, and vesicles of oral mucosa. Treatment: acyclovir accelerates the healing and reduces acute pain. Effective therapy for post-herpetic neuralgia includes application of capsaicin.